Hello dear doctors, if you're new to my channel, my name is Dr. Shabaz Ansari and as of now I'm working as an acute care clinical fellow in the North Wales, and here I am here to be with another video. I'm going to be talking about how to manage time during a PLAB 2 exam. Okay, so I've been receiving this question for quite some time, that how did you manage to manage time in your exam? How did you manage to finish your exam on time? Well, to be very honest, I was never bothered about finishing my station on time. I was never bothered about I've got a time limit, because as I was practicing, I got the idea that it's not the actual time limit that we're bothered about. It's basically the hustle that we need to talk and give everything on the other side, so they would be aware that we know a lot. So the thought process of mine when I went to my exam, or when I was practicing for the exam, was that a lot of the doctors, a lot of candidates actually are so focused on thinking on finishing the exam on time, that it doesn't really matter how scripted you are, how good of a conversationalist you are. The most important variable, which actually a lot of doctors forget, is the patient, because it doesn't really matter how good your script is, how good the whole conversation is going on. The variable which is actually in the equation is the patient. So, and the conversation is basically patient centric, so you have to steer your conversation according to the patient. If they've got any concerns, you'll be addressing their concern. If he's scared, if he's worried, he's angry, you'll have to calm them down. You'll have to accommodate according to their expressions. So that it is what it is. So the first and foremost mistake that a lot of doctors make is that they don't read the station very thoroughly, because most of the times it's very easy to pick up in most of the stations that what are you looking for, what is the main concern, or what is the diagnosis that you're looking for. If the patient's coming with a history of cough, obviously there will be complaints regarding the chest, so there are a couple of conditions that you need to figure out and rule out. So it's pretty easy. So read the station very thoroughly again and again. It might be very easy, it might be very vague, so you never should actually spare any time, just stand there. So read everything once, twice, maybe thrice if you've got time. And the other thing would be that there are two kind of stations. Either it's going to be a history taking station, or it's going to be a counseling station. And the time management should be, if there's a history taking station, obviously you'll have to make a diagnosis, you'll have to ask a lot of questions, whereas in the counseling stations you have already been given the diagnosis and you're just giving the counseling. In history taking station, you'll be asking a lot of questions and the patient will be answering a lot of questions, whereas in the counseling stations you'll be answering the question of the patients. And the time management should be in a sense that in a history taking station, since you're making a diagnosis, you're formulating your diagnosis, it should be near to 4 to 5 minutes of history taking and 3 to 4 minutes on management itself. Whereas in the counseling station, where the diagnosis has already been made, you should be focused less on the history and ask very particular and peculiar questions which will actually help you in the management. So the history taking should be 3 to 4 minutes and the management should be 4 to 5 minutes, because you'll have to talk a lot and ask only the question which will actually help you in the management and advising that what things you could have done better. And okay, the next thing is that a lot of people actually have memorized their history taking in such an amazing manner that they have to go through every question, every small information. I'm not saying that any question is a bad question, but since you've got a time limit, since you're being assessed on your conversation skills, how will you be able to manage a patient, talk about their concerns, address their queries? So you have to be very cheeky and very choosy about the question selection that you might have. So ask questions which might be related to the condition right now. Like for example, if the patient has come in with cough, he's a young patient, so it doesn't really matter if he is having a healthy lifestyle, what is his diet like, what he is his living condition. It is certainly important, but in a time sensitive manner, I don't see any concern about that, or if the patient is having menstruation or not. So it doesn't really make a difference, to be very honest. And you have to ask the most important questions as well. So that comes with practice, like what is important and what is not important, and it's something which you will learn on your own, and the more you practice, the better you get. Okay, you have to basically ask smart questions which actually save your time. One question gives you a lot of answers. Like for example, if the patient is coming for a follow-up and it's a counseling station, he was admitted for an MI or had an infection, he had been going on, he was admitted, and a whole full course of antibiotic was given, and now you're actually assessing them so they can be discharged safely. So you still have to take a history. So in order to get an idea that what was going on, how he came, what happened, just ask them, okay, I'm reading from these notes that you had an chest infection, or you had an MI, or you had whatever. Could you just walk me through so I have a better idea what I'm dealing with? So the patient will actually tell you the whole story, that okay, I had a chest infection, I came in with cough, I was admitted here, I was given IV antibiotics. So now you have an idea that what was the complaint then, and now he's feeling better. So in order to make sure he's safe to be discharged, just ask them quick questions that okay, do you have any symptoms similar to those that you have earlier with which you were brought in? So you're basically asking the same question, but in a cheeky manner, that the symptoms you were brought in with, do you have those right now? So basically you've asked the same question, that oh, do you have any cough, do you have any fever, are you feeling well? So it's the same thing, one question compared to 3 questions. But this comes with practice. It might sound a bit difficult when I'm telling you, but it comes with practice. So if you practice enough, you'll get the idea. And the other important thing is, if you feel like you've asked less questions and now you want to make sure that you've not missed anything, just summarize to the patient. Okay, thank you for the conversation that we have had. You've just told me that you had a complaint, you had this pain, or you had that pain for which you took this tablet, but it's getting worse. Just summarize everything that you've asked, and now just conclude, just to make sure that I've not missed anything. Is there anything else that you would like me to know? So this is a very smart way to ensure that you have not missed anything, the history taking, and you're not rushing yourself, and you're out of questions. But in order to make sure that the patient has told you everything, you just ask them directly, is there anything that I'm missing? Okay, just to be safe. Okay, and the last and by far the most important thing is, never ever aim to complete the station, because you can never certainly complete a station. You can never end up taking a full history, verbalize the examination, deduce them, and give an appropriate full-blown management. Always aim to cover the most important things. For example, give them a diagnosis, rule out the most important emergency condition that you might have. For example, if the patient has come in with a chest infection, rule out any PE, rule out a pneumothorax, rule out an MI. So this signifies that you're a safe doctor, and just give the most important management points that you should not skip. Like, I'm just going to give you a very common example, that if you're suspecting if a patient is having a sexually transmitted infection, just make sure you give them the advice that your partners also need to come in for a checkup if you have had an unprotected sex, or give driving advice to a patient who you're suspecting might or has had a TIA, or you're suspecting a patient might have an obstructive sleep apnea. So these are the really vital important points that you need to cover in order to play safe, that okay, it doesn't really matter, I have not finished the station, it didn't really matter that I've not actually completed the management, but I did cover the most important part of the consultation that needs to be addressed. And then you're safe, because nobody is expecting you to take a full-blown history, verbalize the examination, tell them about the examination in detail, about the findings, and give them a full-blown management, because the most important thing is that you're actually a junior doctor. Nobody will be expecting you to completely give the whole management plan. You just need to signify the most important things, that have you covered the important diagnosis, have you ruled out the emergencies, have you given them vital pieces of information and advice, and have you told them that okay, you're playing as a safe doctor and I will involve my senior to make sure everything's fine, and did the safety netting okay, you're okay, you seem to be nice, you seem to be fine, but just to make sure if there's any deterioration, if you feel like your symptoms are getting worse, it's best to come back, and you played safe. And that's about it. I hope you like this video. If you feel like I've not addressed any particular question, you can always comment in the comment box below, and I am here to help you out. And if you have got any other questions that you need me to make a video on, please advise away, and like, comment and share, so other people can be benefit from this video as well. So yeah, bye bye.